Welcome to Thriving at Work After Sickness Absence. Thank you for joining us today. This webinar is part of our Harnessing Talent Alliance series. Harnessing Talent, Alliance for Recruiting and Retaining Canadians with Disabilities, is a 3-year project funded by Employment and Social Development Canada. We would like to thank our 9 founding partner organizations, as well as our academic team. If you would like to learn more, please visit our website at harnessingtalentalliance.ca. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program, through the BC government, as well as donations and memberships to WWI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions related to the presentation. We will collect questions submitted throughout the presentation and follow it with a Q&A based on the questions submitted. Any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website along with the slides. You will be emailed the direct links for all of these items when they're available. Today we're welcoming Dr. Karina Nielsen. Professor Karina Nielsen is Chair of Work Psychology and Director of the Institute of Work Psychology at the University of Sheffield in the UK. Her main area of expertise lies within organisational interventions, focusing on how we can change work practices and procedures to maintain and improve employee health and well-being. She's also interested in how line managers can promote employee well-being and how we can develop sustainable workplaces that enable workers to perform well and thrive at work. Karina, welcome. Thank you so much for accepting to do this webinar all the way from the UK. I will let you take over.
Thank you very much, and thank you very much for the invitation. It's a pleasure to be here virtually. So what I'm going to talk about today is a project that we conducted in 2018 and 19. And what we're looking at is how can we support people who return to work after a period of long-term sickness absence due to a common mental disorder. And we define a common mental disorder as stress, anxiety, and depression. I'm hoping everybody can see the slides, otherwise give me a shout, a virtual shout. So what I'm going to be talking about today is why return to work following mental illness? Why do we need to look at that? Why is this important? A little bit about the methods, what did we do? A lot about our findings and some of the implications for well-being and productivity. So why do we need to be looking at this? And I'm sitting in the UK, I'm in the UK context, but I'm hoping that a lot of these results will resonate with the listeners as well. The issue in the UK is that 1 in 3 fit notes are issued for mental disorders. In the UK, we have fit notes, we don't have sick notes. So the focus is on how can we help people work. So when you go to the GP, you get a fit note. But 1 in 3 of those are issued because of mental disorders, which is quite substantial. In the UK also, 57% of lost workdays are due to stress, anxiety, and depression. And it's very costly for society. Some of the issues that we find is that the longer people are on sick leave, the less likely they are to return. And some figures say that even if they do return, a lot of them experience relapse and up to 20% exit work. So it's really a substantial problem, both for society, because we lose out on valuable workforce, but also for families and for individuals themselves. They don't have a stable income, they don't have the work identity. So we need to be looking at how can we help people stay at work. One of the things that got me interested in this area is that I've done return to work research before, and there's a lot of focus on helping people get back to work. But I was really frustrated because we know that relapse is quite high. So we need to be looking at how can we prevent them from relapsing, but also how can we not just prevent them from relapsing, how can we also support them in thriving at work once they return. We don't want them to return and they're just hanging in there with the skin of their teeth. We want them to have a meaningful working life. hopefully until retirement. So that's what we wanted to look at. How can we help do that? Some of the challenges that we can see is that there's not enough support for workers who return. Part of the issue is that managers do not necessarily know how to or can't afford to make work adjustments, so they don't necessarily have the resources and they don't necessarily have the skills and the knowledge. On the other hand, we also found that employees themselves, workers who have returned, are unsure what to say and what to do. So that was kind of what we were trying to do, is trying to find out how can we provide better support for people who have returned to work after long-term sickness absence. What we did was that we interviewed 38 employees and 20 managers, line managers with responsibility for people who had returned to work. We wanted to get a longitudinal perspective, so we interviewed over multiple time points. Ideally, we had planned to interview in the first month after return and then the following 3 months. But we had a lot of people coming to us and saying, you know what, I've been back at work for a year, maybe even 2 years, and I'm still struggling. So we decided to interview whoever thought it was worthwhile for them to share their experiences with us. The theoretical framework that we used was the IGLO model that we have developed and published, and I'll come back to that in a second because the next slide is an overview of the model. But it's essentially what we want to look at is what are the resources that can help returning workers stay and thrive at work, both at the individual level, the group, leader, and organizational level. And we say that there are resources at all these levels that can help returned workers. So this is an overview of the IGLO model. So what we are saying is that there are resources both in work and outside of work that can help people experience what we call sustainable return to work. So if we look at the work side first, we imagine that there are resources in the organization that can help people stay and thrive at work once they have returned from work or return to work. So they're both resources within the individual. So that could, for example, be self-efficacy, or their abilities to craft a job that helps them meet their needs. So one of the things that we find is when people return to work, even if they're in remission, they still have reduced work functioning. So we need to make sure that they can stay and thrive at work, even with that reduced work functioning, because they're still valuable workers. So resources within the individual, it can be job crafting, it can be self-efficacy, it can be other resources that stem from within the individual. There are also resources at the group and the team level. So how can your colleagues help you stay and thrive at work? There's also the things that the line manager can do. There are also organizational factors, and this can be occupational health, or it can be human resources, it can be work-life balance policies, return to work policies, all these kind of things. If you haven't guessed already, I'm not English, I'm Danish, and in Denmark the IGLO only has one O, but of course in English it's got two O's, so we needed to come up with a solution, and this is also relevant for return to work. So what we're looking at is outside influences. So what kind of legislation in the different countries can support people stay and thrive at work? But it's not just resources of the work side, it's also the resources outside work, the home resources that we need to be looking at. So what individual resources do we have within ourselves that are not related to work that can help? For example, a healthy lifestyle. What kind of group and social networks do we have outside work? Friends, family? Links to other services. Of course, outside work, you don't have line management, but what kind of links do you have? Like, for example, relationship with your GP, your general practitioner. What organizational factors are there outside the workplace? So, for example, charities, community services that can help you stay and thrive at work. And then at the outside influences, we have welfare and healthcare that can help you stay and thrive at work. This is a framework that we developed, and we did a literature review, and we found that there's a lot of literature on returning to work, but there's not so much literature on staying and thriving at work. So what we did was that we came up with all kinds of assumptions of what we thought could be resources at these 5 levels, both at work and outside work. Then we were so lucky that we got funding to look at, so what are the resources that people actually experience? And that's when we went out and we interviewed the 38 employees and the 20 line managers. So what I'll do now is that I'll go through each of the 5 levels, well, the 4 levels, and then talk about what were our findings. For some of these things, we found things in our interviews, but we also rely still on the literature review. So when you see green writing, it's because it's from our interviews. When you see writing in black, it's because it's from the literature review. So if we start at the individual level, so the resources at the individual level, we found very much that job crafting, that is the extent to which people craft a job that fits their needs or meet their needs, has a huge impact at the individual level. So some of the things that we found that they did at work was task job crafting. So a lot of them reported that they found it really hard to concentrate when they returned to work, and if they didn't have meetings, they didn't have structure, they would kind of get lost and get anxious. So what they would do to remedy that anxiety would be to try to create their own structure in the day. They would be identifying discrete sub-tasks. They would be identifying and prioritizing core tasks. So these are the tasks I have to do. These are the tasks I have to do now. These are the most important ones for me. What they also did was that they started to introduce small breaks between the tasks, so it gave them the opportunity to refocus and to better concentrate at the task at hand. What they also did was that they engaged in what we call relational job crafting. So they also tried to manage their social relations with their colleagues and managers in a better way. So, for example, some of them would feel overwhelmed by too many meetings, too much interaction. So they would not necessarily go to all the meetings that they would have gone to before they went on sick leave. Or, for example, what they would do was that we had people who worked at universities in a shared office. So, for example, they would go and work in the library, or they would work from home, or if they had to be in a certain location, they would wear earphones so they could create a little bit of peace and quiet so they could concentrate on the work without being disturbed by colleagues talking. Another thing that they did was also that they would set colleagues' expectations. So they would communicate to colleagues that, you know, sometimes I'm having a bad day, please just leave me alone, leave me be a little. Or they would also be setting expectations of this is the type of work that I can do and when I can do it. So they try to set boundaries in relation to the colleagues as well. In terms of what they did in the non-work or the home context, was again that they would engage in task job crafting. So they would introduce clear boundaries between work and leisure. So some of the things they would do was that they wouldn't take their laptop with them. They wouldn't have the email on their mobile phones. So when they were working, but when they are off, they weren't working. Many of them also introduced a walk after work, so they kind of got a clear demarcation between work and leisure time. And they found that really useful in order to create the space. And many of them said that they were much better at working when they were working and concentrating while they were working, rather than the boundaryless working where they worked all the time. What they also did was that they engaged in what we call cognitive job crafting, so thinking differently about their job. So they would be more focused on having a life outside work. So they would start having hobbies. They would have more focus on exercising and on cooking, taking cooking classes, taking up hobbies. Again, they would set realistic expectations about the job. So maybe I'm not at this point in time meaning to have a fantastic career and make it to senior executive in the next 5 years. Maybe what I want to focus on now is being a good employee and getting something out of my work life at the same time as managing my mental health problems. What we also found was that some of them would want to give back. So after they had returned and they had gained some experiences of how to manage returning to work and thriving at work, they would volunteer to support others with CMDs who returned, so that they could use their experience and put it to good benefit for other people who were in the same situation. And as I said before, it's recommended when you suffer from depression, for example, that you focus on exercise and nutrition. And they said it was really important that they continued this focus after they had returned to work. In terms of the group level resources, what we know from the literature is that support for the returner is higher when there are good relationships prior to absence and there's a collective identity of the team. So what we mean by that is that it can be quite difficult to return to work if you're in a competitive team. We know that people have reduced work functioning, so if people aren't, you can call it forgiving or accepting of reduced return or reduced work functioning, that can be a problem. It's also important that you feel part of the team, that you feel part of a group. That makes it easier for you to return and work with these people again. What we found, especially in our interviews, is that what a lot of our participants said was that it's not necessarily that colleagues are in your face constantly asking, how are you doing, can I help you? It's more knowing that colleagues are there if you need them. So be supportive in an indirect way. In terms of non-work, the literature shows, and so do our interviews, that understanding that people have a mental health problem, that they do struggle, and provide emotional and practical support from friends and family is important. In terms of line managers and links to services, some of the things that we found was that a good relationship between the line manager and the employee is important. This is probably no surprise to anyone, but it's important that the line manager is available and listening to the employee when he or she needs it. So again, it's not necessarily being in your face, asking all the time. It's more an issue of the employee knowing that if I do have a problem, I can go to my line manager and they will listen. One of the things that came up in the interviews, and I would be interested in hearing your views on this, is that some of our participants said that it really helps me that my line manager has got experience with mental health problems themselves, because I feel that they can understand me better. I can kind of see where they're coming from, but on the other hand, it's also, well, we can't really appoint line managers on the basis of them having mental health problems. So I think there's a balance to be found, and some knowledge that needs to be found out. How can we, what kind of skills and resources can we give line managers so they can provide the necessary support for employees who have returned? It's also important that line managers, they are the first point of contact, so they can give you access to other support, either in the organization, outside the organization. So for example, well-being services, counseling, these kind of things. Again, it's important that knowing support is available, that you can approach your line manager. One of the things that we found in our interviews is that quite often, especially the way it works in the UK, is that you are part-time the first month after return, and your line manager works out a plan with you for the first month. But what we heard was that it's really, really important that you make the plan, but you also revise the plan as and when needed. So it can go on for 6 or 7 months, or maybe even longer, that you continue to revise the plan. So you make a plan, what kind of tasks can the return worker take on now? And then you revise, so are you ready to take on those tasks, or new tasks, or existing tasks that you had before now, or should we wait? And make adjustments continuously as and when the employee needs them. In terms of the home or non-work context, we found that a good relationship with the GP or the healthcare provider is important, so a trusting relationship. One thing that we found in the UK is that it's important to have a stable relationship. So the way things work here is that you have your general practice, And when you go to your GP, you don't necessarily see the same GP, which is a problem. We had a really good example of a returned worker who had been to the GP 3 times, or her general practice 3 times, and each time she had seen a different GP, and those 3 GPs had each given her a different mental health diagnosis. So it's really important that you have a stable relationship. You see a GP that understands you, understands your problems, and knows your history. In terms of organizational level resources, it's important that the organization can give you access as a returned worker to well-being services, to cognitive behavioral therapy. We found that our participants said that CBT with a work-focused element was particularly important, and what they found really useful was to be able to, so if you have something coming up at work that you're anxious about, you can talk that through with your counselor, and you can kind of say, okay, so these are the kind of scenarios that I can imagine is going to happen, and this is how I can address it most appropriately. They said that was really useful. A number of human resource management practices were also found to be effective by our participants, such as individualized return to work plans, flexible working, perhaps coming back part-time, but also continuing to work part-time. One of our returned workers had been back for 2 years, but she would only work 4 days a week because that worked for her. And some would take a longer weekend, some would have the Wednesday off, depending on what worked for them. But what was really important was a phased return, so that it was discussed both in terms of time, when can you return, but also what kind of tasks can you take on. We had another participant who prior to going on sick leave would drive a lot, and she suffered from depression, and she would have these suicidal thoughts that she could crash the car when she was driving. And of course, when she returned, that was one of her concerns, that would she have those thoughts again if she got into a car. So she was actually back for 2 or 3 months before she actually got in the car and did one of those drives. And the first time she did one of those drives, one of her colleagues would follow her in another car, so she wasn't on her own. So there was support available to her, but it was an adjustment of the work tasks, and she would take additional work tasks on as and when she was ready for them. From the literature, we know that ability enhancing practices, for example, assertiveness and time management training, can be effective. In terms of home and non-work resources, community and voluntary organizations and services provide valuable support for workers with CMD. So, for example, in the UK, we have a charity called Mind. So in a lot of organizations, they do have really good services available, both internally and externally, but in some small organizations, that might not be the case. And then it's really important that the returned worker has got access to these kind of services and support networks outside the workplace. In terms of the overarching context or the external influences, we don't have so much of that because our participants were in the UK only, but we know that policies and practices operate within a national context, and what that national context is really important. So for example, in the UK, it's relatively easy to get rid of people, to fire people, whereas in the Netherlands, for example, if you have a worker that goes on sick leave due to, goes on sick leave, the organization has to pay for sick leave for 2 years, the first 2 years after the person goes on sick leave, which of course means that organizations are really motivated to support people returning to work because it costs them a lot of money. So those kind of national policies and practices have a really big impact. There are also societal norms. So is it normal or usual to talk about mental health in the workplace, or is it stigmatizing? In the non-work context, we found that in the UK, stigmatization is really important. I don't know whether you're aware of it, but there's an initiative called Time to Change in the UK. And the royal family has been really proactive and open and talking about mental health. And what we found from our participants was that many of them would say, well, actually, this had meant something to me, because if they can manage it, if they can deal with it, so can I. So in that respect, the royal family has in many ways become a role model for how to deal with mental health issues in the UK. So this is just coming back to the model. So what we found, we did find support from our model in our interviews. So we did find that there were resources and the individual, group, line manager, and organizational and outside influences, resources at all those 5 levels, both inside and outside work, that had an impact on people's ability to return to work and thrive at work. So what I just want to do here at the end is to give you an example of what one of our employees said. So what are the implications for well-being and productivity? What is sustainable return to work? If you noticed, I haven't defined that. It's one of the things that I would like to hear from you. What is sustainable return to work from you? In the literature, there's a lot of, some definitions are that if you can stay at work 3 months after your return, then it's sustainable. But if I have 20 years left on the labor market, then 3 months is a drop in the ocean. So we need to be looking at what is sustainable return to work. So we have one employee who said in month 4, so the 4th time we interviewed her, for me, it's about creating that environment where I'm able to work, to function on some level, even if not at full capacity. It's tricky because every organization, every person is different. Whether we look at sustainability through something formal, from a legal perspective, or something sustainable from a moral stance, I don't know, but I know what I need to sustain myself. I know what's important for me. That may not fit everybody. People are different, values are different. So that's really difficult. I think there's no definitive answer. It's such an individualized need that people have. And I think she says it really important. It's not necessarily that I can work at full capacity, but it is that I'm able to work, that I'm able to make a contribution. And what's right for me isn't necessarily right for everybody. So it's a conversation that you have to have with a returned worker, because only they know what's right for them. So in summary, what the messages that I've been trying to get across here is that what we need to do when we look at sustainable return to work is that we need to consider the resources at all ECLO levels, both at home and at work. And that also means that we need to implement multi-level interventions. So we need to develop interventions for both the individuals, for the group and colleagues, for family, in and outside work, for line managers. We need to equip them properly to do the job, supporting people return to work and thrive at work. We also need to have human resource policies in place. We need to have occupational health services in place that can help workers sustain a good working life in the long term. We need to equip managers with the knowledge, the skills, and the confidence to support the returning employee. Sometimes what we found was that line managers had a lot of good intentions, but they didn't feel comfortable talking about these things because they didn't feel they had the skills and the knowledge, so they weren't confident. So we need to build line managers and managers' confidence, having these difficult conversations. We also need to encourage returning workers to draw on a range of resources. They shouldn't feel that they have to do this on their own. There's a lot of resource available to them that can help them stay and thrive at work. So I think that's a really key, important, that they're not alone. It's not something that has to be solved in solitude. It's something that you have to solve and work on together with others. I also think what we need to do is to reorientate our systems so we can cope with the fluctuating conditions. What we found was that many employees would come back to work, they would work well for 6 months, then they would have another mental health problems, or they would have a recurrence, and then they need that support. Some of the things that we saw was that the employees would say, well, what would really work for me is flexible work, so I can take holiday at short notice if I don't feel well. Rather than me having to go on sick leave, I can nip it in the bud. One of the things that we saw in some organizations in the UK is that they have really, really strict sickness absence policies. So if you go on sick leave within 6 months again, then you automatically go on capability or performance appraisals. And of course, if you suffer from anxiety, it's not going to help that you fear that you might suffer a disciplinary action if you go on sick leave again. That's something you can be very anxious about. So it's kind of understanding the type of issues that people with mental health problems are facing, and adjust our policies so that we can support these people rather than aggravating their symptoms and their concerns. And again, we need to work in a flexible, individualized way if we want to keep people at work in the long term, because there's no one size fits all for sustainable return to work. So this was a project that was funded by the ESRC for the Productivity Insights Network. You can see the link to the report here. You can also see the reference to the conceptual paper. We've also published a paper on the job crafting, the individual resources. If you're interested in that, drop me an email. And finally, what we have also done is that we have developed a toolkit. So what we did was that we have developed a toolkit for individuals, for returned workers themselves, for groups, for line managers, and for human resource professionals. So if you go to this link that's shown here, you can find 4 different sets of toolkits for these 4 groups. What I'm going to do now is basically just show you briefly the one for colleagues. So this is a front page. What can you do to help a team member returning to work? And first we have an explanation. What is the ECLO? Why is this important to look at? And then we have the introduction of what is stress, anxiety, and depression, and what can you do at the different levels to support your colleague. What are the resources that are important for returned workers, both in terms of home, but also at work. And then we provide an action planning template so that workers or colleagues can make their own action plan for how can I support my returned colleague. So it's basically at the 4 levels. We've got the individual level. In terms of work, you can ask yourself, do I help my colleague that has returned to work create a structure during the working day? Do I do this? Yes, no, sometimes. Do I need to do something different? So if I'm not doing it very often, I'm not doing it at all, how can I do this? And the last question is that you can't see, or I can't see it at least. Is that I can make this happen by doing this, that, and the other. So it's basically allowing colleagues to make an action plan for themselves, saying, I really want to help this worker that has returned, this colleague that has returned, this is how I can do it. So they can go through individual at work, individual at home. So how can I help my colleague who has returned prioritize self-care? How can I ensure that this employee has clear boundaries between work and home? Does that involve me not emailing that colleague after 5 o'clock if we have regular working hours? Or does it involve me not sending emails, not calling? How can I support that colleague in establishing clear boundaries? And again, at the group level, do I as a colleague provide feedback on the task? Do I try to build the returned workers' confidence in completing the tasks after they have returned? Do I help my colleague when I know they've got a challenging task? Do I help without? Can I help them out with that challenging task? How do I do it? What we also found that a lot of our participants said that it's important that I'm treated as a worker, as myself, as who I am, not as a person who's got a mental health problem. So do I behave towards my colleague in that way? And am I sure about that? And how can I make sure that I do that? And of course, as a colleague, you can't necessarily influence friends and families, how they behave outside work. But can you kind of, if they report or tell you that they're having problems outside work, is there anything that you can do at the workplace to support them. And again, is there something as a colleague that you can check in with the line manager about what does the employee want us to know? And they might not want you to know what the problem is. We had employees who'd been on sick leave that hadn't reported at all why they came back. They were gone for 6 months and then they came back, and colleagues just said hi and didn't ask any awkward questions. And some of them never knew why they'd been off. We also had some of the more negative experiences in terms of some line managers telling too much, too soon, and too often. So it's important that both line managers, and in this case also colleagues, that you don't necessarily put a lot of pressure on the line managers to reveal information that the employee doesn't want. Also accept as a colleague that the line manager might put support in place and make work adjustments that also influence you. So you might have to do some of the tasks that the returned worker doesn't feel comfortable or able to do just yet. And also, can you support in any way that the line manager is actually available to that returning colleague? At the organizational level, you as a colleague can be aware of what kind of policies are available for flexible working, so you can share them with the returned worker if needs be. You can also support the employee in accessing flexible working and work adjustments, so making suggestions. Have you thought about doing this, or I could do this for you? There are these resources available within the organization. And also knowing, so is there counseling available, and encouraging or supporting the returned worker to accessing that counseling. So on the back, you basically have a picture of me and my colleague, Joanna Jarker, from Affinity Health at Work, that has developed this toolkit. I worked with her on the project. And we also have some other professional bodies and mental health support resources available at the back, the links to those for those who need further support and access to support. So that was all I had to say today. So some of the questions I have for you is, what is sustainable return to work for you? Is it returning to the same job with the same tasks? Is it returning to the same position? If you've been in a senior management position and it's been really, really stressful, is it perhaps better to go back into another position that's less stressful? Is sustainable return to work not experiencing any relapse, not having any recurrent sickness absence periods? Is that realistic? A lot of the interviewees that we were talking to had 2 or 3 relapses during their time on the labour market. I'm also interested to hearing some of what your experiences are in supporting sustainable return to work and what kind of tools you use.
So to our audience, if you have any comments in regards to the questions that Karina just asked, please insert them in the question box. In the meantime, I would just like to say that many members found this research extremely interesting and would like to read the full report and related resources. So would you be able to provide some links post-webinar so we can post them on our website and share them with everybody?
Yes, perfect. Absolutely. Yeah.
One of our members says that they use the coach approach.
Yeah. Can I just make a note of that?
Of course.
Yes.
And then another one says that my experience has been that employers are not generally sympathetic to mental health absences and supports are limited.
I think we saw everything in our survey. We interviewed some people that had just had the most amazing support at all levels. Their line manager, their colleagues, the organizational level, fantastic counseling services. And some of them actually said, you know, I'm a better employee now because going through this process, they had become more aware of I don't know whether you could call it their limitations, whether that's correct to call it that, but what their strengths and weaknesses are. And they had received that help to work with their weaknesses, so they felt they've come out a stronger person. So that's a positive, and I think that's really positive that we do have those stories, because I completely agree. We did see some gruesome stories out there. We interviewed one employee, for example, who told me that she had heard from her line manager twice while she was on sick leave. And the second time was basically saying, if you're not back in 3 weeks, you are out of a job. And when she then returned, all her boss would say was then, so are you actually working? She would have no return to work interview. She would have no work plan. She was working from home. There would be absolutely no communication. And can you imagine suffering from mental health problems, anxiety and depression, sitting at home, no contact to colleagues, no contact to your line manager, no support whatsoever? She was just sitting in this void, really, really struggling. And I think it's just devastating that that's how you treat employees. So I think we got all kinds of stories, and I think what we need to work really hard on, and that's why we're so passionate about this, is that sometimes it's, I don't know whether you can call it ill will, but I'm hoping that a lot of it is because organizations don't know how to. So if we can educate them and get the message out there on the how to, then I'm hoping we can help a lot of people who return to work and are experiencing problems.
Absolutely. Audience members are commenting it's very effective to address their specific challenges, their perspective. Challenges include the support from the clients, employer, organization. As clinician, taking the time to have everyone on the same page and address concerns before we start a gradual return to work. Another comment is, I am an occupational therapist and coach, and part of the process is to use 2 OT questionnaires in preparation for the return to work, the worker environment impact scale, and the worker role interview.
I completely agree. It's those kind of tools that can help us develop a good plan. But as I said before, I think it's also really, really important to continue to have that conversation. And giving that support. So you might make a plan before you return. That plan might have to be adjusted because you don't know what the situation is and how you feel once you return. And what we did found was that, 1 month you can do extremely well, you can take on the world, you feel you can take on all your previous tasks, and then 2 days later something happens and you just crash and burn. And that's unfortunately, I think, the reality of many people with common mental disorders. So it's having that continued discussion of how are you doing, how are you getting on, how can we support you, how can we adjust work and continue to adjust work. So I think it's important to have a long-term perspective as well, but of course it needs to be there from the start.
Mm-hmm. Our audience is still sharing some of their experiences, and they say, I agree that it is needed and it is the gold standard. However, as an occupational therapist and educator of short-term disabilities claims, this is the exception, not the rule. Pressure is coming from all the areas, financial, HR, line employees, and the recurrence are frequently viewed as holidays. Another one says, I've also found a lot of managers are simply nervous about doing and saying the wrong thing. One of our members, who is an occupational therapist, says, my role is to help provide that education and awareness, and this webinar has been very helpful in providing a framework.
Good, thank you. I'm really happy to hear that, because obviously that's why we do the research. But I think it's so important to create the awareness. And I mean, being Danish and being in the UK, you can really see the differences, because in Denmark it's a lot more normal and usual to talk about mental health problems. There's not so much stigmatization, whereas over here you can have people saying, I would never mention it. I had a mental health nurse who said, I would never, my colleagues do not know that I've been on sick leave due to depression, because I would get judged. And this is a mental health nurse that works with people with mental health problems every day. And I think that says something about the scale of the problem, about the stigmatization that you experience even within mental health care itself. And I think that's really scary. But I think the first step is to start talking about it. But then it's not only about talking about it, it's also equipping people at the different levels to deal with it. So they build the confidence that I actually know how to. And one thing that I can recommend is that at St. Mary's University in Canada, there's a professor called Kevin Kellaway, and he has, I don't know whether you're aware of it, but he has developed this mental health awareness training for line managers. He's also developed mental health awareness training for colleagues. And it's scientifically proven that it does work. So that's as a professor, I think that's amazing. But we need to educate people in how to deal with these issues, and I think that's a really good step. First, the awareness, but then also equipping people to how do I deal with this. And what I like about Kevin Kellaway's Professor Kevin Kellaway's mental health awareness training is that it's short, but also that it's not about treating, it's not about diagnosing, it's understanding what are the symptoms, what are the things that can alert me to something being wrong in my colleagues. And then there's a tailored approach. So within this organization, where can I send people for support? So what kind of resources are there available within the organization that can help me provide the necessary support for these workers? So it kind of takes the strain away a little from the line manager, because it's perfectly, I completely agree. It's not necessarily that it's ill will. Sometimes they have conflicting demands, so it makes it difficult for them to provide the support. But other times it's because they don't feel comfortable having that conversation, and it might be easier to ignoring problems than actually doing something about it because they don't feel equipped to it. So I think the most important thing is awareness, but also equipping people to deal with the issues at the different levels within the organization.
Thank you, Karina. And that's what comes up on the comments as well, the lack of training, and that the managers and employers need to be prepared for such situations. So if you don't mind, we will move right on to the Q&A session. To our attendees, if you have any questions, please input them in the question box, and let's begin with our first question. So the first one is, what type of industries were the 38 people from, and did you notice any trends by industry?
We had everything. We had a private sector, we had public sector, we had small organizations, we had large organizations. We were quite lucky to have a fairly large representative, well, not representative sample, but we did have representatives from many different organizations. We had slightly more women than men, but not outrageously so. We didn't necessarily have a lot of manual labor. We had 2 or 3 of those, but I can't see any patterns in terms of this is what it looked like. Well, no, to be honest, in terms of the policies, the public sector organizations in the UK were the ones that had really strict sickness absence policies, and you would go into a disciplinary process if you were off sick for twice within 6 months or something like that. So that's probably the only thing. But in terms of the patterns of what people needed, we didn't see. It was the same across all organizations and all sectors we interviewed in.
Perfect. Thank you, Karina. Next question is, how realistically are these supports available to workers in the workplace? So, for example, cognitive behavior therapy or CBT, how can they help manage stress in the workplace?
Yeah, realistically, that's a really good question. Again, we did see some organizations, of course, especially larger organizations, that had fantastic counseling services, well-being services in place, and people found them really, really useful. What I found quite encouraging was that we talked to several participants where there was good support available through their GP, so there were good community services as well, and counseling services within the local community. So I think that was really encouraging. But again, there were people who really didn't get any support whatsoever. So it in my experience, it varies so much. But again, the more we talk about it, the more we can hope that those that are lagging behind get their eyes open to how can we support workers, because I think it is an issue both at the societal level, at the organizational level. You have invested a lot of money in training people. It's not a great idea to just get rid of people because they suffer from mental health problems. They can still do a really good job and make a significant contribution. So we shouldn't just give up on them, neither as a society nor as organizations. But I have to admit, some of the people we were talking to, it was really depressing to hear their stories, because some of them just had the worst time.
Thank you, Karina. Our next question is, so our audience actually is very impressed with the practices you have mentioned during your presentation. And one of our audience members says, do you have any advice on getting employers to adopt these best practices? This webinar makes me want to move to Europe. I'm concerned that many employers in my country would be skeptical and unwilling to cooperate. And thank you.
I don't move to the UK just now. Again, I mean, I've done this type of research in the Netherlands and in Denmark and in the UK, and let's be honest, in the Netherlands, organizations are really motivated because they have to pay for employees for 2 years if they go on sick leave. So that's a different kind of motivation, but it does mean that there's really good support available. It could be better, it can always be better, but there is a different motivation. In the Scandinavian countries, the culture is just different. We talk about things more openly. Of course there's stigmatization everywhere, but there is a different culture. There's an openness and it's more accepted. And we have the whole tripart system. So we have very little legislation in Denmark when it comes to work policies. We have policies in place that are agreements between government, employees and employers. And unions are incredibly strong in Denmark. And I think that's part of the explanation for why it works relatively well, because employees have an indirect voice through the unions and the agreements that are done in the workplace. So I think that's probably why it works relatively well in Denmark. Over here, I think there's a lot of work to be done still. We do have the really, really good stories here as well, but they're not that commonplace. And it's creating awareness. It is making organizations and employers aware of the benefits. It's education, it's awareness, and it's the support as well. So one of the things my colleague that I mentioned, Jo Jakob from Affinity Health at Work, that I did this project with, she's been looking at return to work for small business owners. So they don't have all these resources. They can't offer counseling, but how can you help them go through the process with their employees? So those kind of things, the more practical toolkits that we can also make available to organizations, the easier it will be for them to manage these processes and manage their employees.
Makes sense. The next question is, you mentioned the GP, so general practitioner, role in diagnosis. Can GPs play some other role in the return to work plan?
Yeah, so here you've got the fit notes, which means that that's another issue. Here we've got the fit notes, which means that the GP actually has to write down what type of job can the worker do. And of course, that's incredibly difficult. GPs haven't been particularly well trained in this, so they're not working according to plan. They're very widely criticized. So I think it's training the GPs also to engage in this process. But I've done several return to work projects, and the problem is that the GP and the workplace, it's just not well integrated. So I think it's getting them to communicate. What we could see that in some cases the GP, again, when there was a stable relationship, it was the same GP. The GP knew about the specific worker's problems and history. They would continue to follow the worker after they had returned to work and provide guidance and input. And I think that's hugely important. And it wasn't something that we saw a lot. quite often once you return to work, that's it. And maybe you get adjustments for your medicine, but you don't actually get that kind of support, and you don't have those kind of discussions of how are you doing at work. And I think that's important from the GP's perspective as well, to engage in those discussions. But the healthcare system in the UK is under a lot of pressure. You have 10 minutes, so you don't necessarily have a lot of time to have those conversations. But we did see it in some general practices.
Perfect, thank you. Our next question is, what do you do when the funding available to access the support is insufficient, $500 per year, and or therapy is not available because the system is overloaded, both in the private and the public sector? What can an individual do when external supports are absent?
I think the first step is then to go to your GP and see, is there any support available? And again, we interviewed people all over the UK, Northern Ireland, Scotland, Wales, England, and it does vary a lot in the different regions of the UK. So I'm assuming it's the same in Canada. But we did see that there was, in some areas, there was support available. And as I mentioned before, charities, Mind, community services. So I think we can also do a lot in terms of making that these different sources of support, creating awareness around them and communicating that there is support available and what kind of support is available outside the organizations. So we had people who had fantastic counseling, or they felt they had perfect counseling or really good counseling outside of the work context. And some of them were also not comfortable getting counseling through the workplace, even if it was anonymous and confidential. So they would seek counseling through other local communities and charities. So I think that's another way of trying to create awareness of what kind of sources of support are available outside the workplace as well.
Thank you, Karina. And I believe we'll just ask our last question. So thank you for explaining the IGLOO model. Can employers have an impact and give their support on every level of the IGLOO model? If so, can you give some examples?
I think it's important that employers are role models. So they have to be role models and communicate out in the organization. You know, workers, it's okay to be on sick leave due to a common mental problem. It's okay to experience problems. It's okay to have reduced work functioning. At the same time, creating expectations and putting resources in place for teams and colleagues. It's okay. You have to support that employee as well. And also in terms of line managers, making sure that they have the resources available, they have the necessary training. So I think employers play an incredible important role at all these levels, putting policies in place at all levels that enable workers at all levels and line managers to support returned workers.
Perfect, thank you. And Karina, would you like to add the last message to our audience today before we end the webinar?
I just wanted to say thank you very much for dialing in. If you haven't guessed, I'm really, really passionate about this. And I think the more we talk about it and the more we get the message out there, the better conditions we can create for a good workplace for everybody. And there should be room for everybody. We are all different and we all need support, and especially returned workers need support. So the more we can create these kind of fora where we discuss these things, I think that's really important.
Perfect. Thank you so much, Karina, for teaching us about the IGLOO framework, as well as strategies and types of support available for the return to work of employees with common mental health conditions, and for answering our series of questions. And to our audience, thank you so much for your engagement and your growing interest in our webinars. Immediately following the webinar, you will be directed to the evaluation survey. We greatly appreciate your input on our webinars, as well as suggestions for future topic areas. If you would like to get a certificate of attendance for this session, please email your request to project@www.dpi.org. Members of the Work Wellness Institute receive free certificates. If you're not a WWI member, the administration fee is $15. Our next Harnessing Talent Alliance webinar is Migraine and Other Headaches at Work. The webinar will be presented by Dr. Anna Andreou, Headache Research Director at the Headache Centre in the UK. All of our webinars are created for public access and supported by voluntary donations and memberships. Thank you again for your participation, and thank you immensely, Karina, for being with us today. Bye-bye.
Yes, my pleasure. Thank you. Bye.